Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and summer is right around the corner. Spring starts tomorrow, so that means about 3 months until summer, and it's the perfect time to talk about shedding a couple of pounds. Today on Healthline, we will be talking about weight loss and wellness. Joining me today to talk about this is Irina Haskatis and Catherine Rogers with Shed It Weight Loss and Wellness. Thanks for being here.
We're excited to be back.
Absolutely, yes, and you guys are the experts in weight loss and staying, healthy. And so, give us a preview of what Shed It offers, Irina.
So Shed It was one of the first companies here in the Shreveport-Bossier area to offer the GLP-1 class of medications. The brand names are Mounjaro and Ozempic, or Zepbound and Wegovy. The generic names are semaglutide and tirzepatide. So we specialize in those injections. It's weekly injections, and they have had tremendous success with rather few side effects.
Right.
So it's been a great new class of medicines that can help people really get in shape and get healthier.
Right, and so you mentioned that, so you are one of the co-owners with Shed It, and so what was your vision for bringing this to the Shreveport-Bossier area?
We actually have been seeing those articles, that Shreveport-Bossier, the metro area, is one of the most obese areas in the United States. Believe it or not, this year it's actually the 6th obese biggest area in the States. And we thought that there's a need. And when we took over the clinic, which was mainly focused on Adipex, it's a medication that also works but has a lot of side effects. We are also not offering the medication now in our clinic anymore. So we thought that this new class of medicines can really help people with less side effects. And we see great success, so that's why we think we are in the right market and can help a lot of people in our community.
All right, yes, for sure. And a lot of people are thinking about, okay, summer's right around the corner, bikini season, maybe going to the beach or going out of the country to like a tropical destination. And a lot of times you're not going to, you want to feel your best and you want to feel confident. And so, Catherine, tell us about how Shed It makes this an individualized approach for each of your patients.
Yeah, so now is the perfect time to come see us. We would sit down, talk about, everyone's medical history, weight loss goals, those are specific person to person, what time frame we're looking at also, and then we come up with a medication, a treatment plan, like I was saying earlier, protein goal, water goal. We discuss just kind of all the different things we can do to get set out on the best foot, and then we also check in month to month. So, we see how things have gone, our progress, if we had any trouble or issues, and so it really now is a good time to get started, especially if we've got some summer goals in mind.
Right, yeah, and you also have mentioned in the past that you kind of set a like a specific weight loss goal for each person, right? And you have these realistic goals that you set too. So tell me about what would be a realistic goal to achieve. Let's say if somebody came to you today and they wanted to be at this specific, or they wanted to lose a specific amount of weight by June 20th, so that's about 3 months away. So what's a realistic goal that someone can set for them?
So, I think realistically anywhere 1 to 2 pounds a week is going to be your safest, most sustainable way to do it. Now with the injections and that, assistance, some people can do better or lose more than that, but we really want to be sure we're not eating too little, too much of a calorie deficit, just because in the long term you can actually reset your metabolism just to be too low. And so, but I think anywhere, 4 to 10 pounds kind of on average a month is definitely a sustainable goal. And like I said, with the help of the injections, people can see more than that. Just kind of depends on, like I said, length of treatment, what people are doing at home, some of the lifestyle things that add into that too. So
for sure, yeah. So that's important to remember that we always talk about these injections, and you also offer oral medications as well. And so they're a tool in the toolbox. They are not to replace the sustainable lifestyle changes.
Yes, absolutely. Like, this is why we work with a nutritionist. They have a monthly wellness seminar where people learn about healthier eating habits. This month it will actually be intermittent fasting, so I'm going to send this out today to all our patients. It's free for them. It's just, people have to understand you have to do some work as well. Like the shots work, but they're not magic and all your problems will be fixed forever. It is really a lifestyle change, and you've got to put the work in and be ready for it too.
Right, and when you're on these medications too, that you want to pay it forward for yourself too. So when you maybe do want to have that conversation with you, Catherine, and you're like, okay, let's talk about maybe coming off of the medications, something that you want to consider is you don't want to regain a lot of the weight that you've lost.
Right.
And so the changes that you make while you're on the medications are really important for that reason, right? Would you say?
Yeah, for it to be sustainable, and then exactly like you said, for us to be able to wean down or maintain and not have rebound weight gain, it really has to be what your daily habits look like, or your 80% of your daily habits. How much water we're drinking, are we getting some exercise, cardiovascular, strength training, or otherwise, how much protein we're eating, how much fiber we're eating. All these little steps that you can make every single day that seem overwhelming whenever you're trying to change everything. So we really try to do a couple of things at a time, but those are going to be the mainstay of getting you forward and then forever keeping weight off, or just feeling better, feeling stronger, things like that.
Yeah, and so if you were, you're kind of doing the sustainable approach to where you're only losing about 4 to 10 pounds a month, which for some people it may not seem like enough or a lot, but tell us what happens if you were to have this ambitious goal of losing like 30 pounds in a month versus the sustainable goal of 4 to 10 pounds.
Yeah, and like I said, with the help of the injections, people can lose more than that, and that often happens, especially in those first couple of months. And I'll get into kind of the science behind the injections in a minute. But, if you just find that you're not eating, or if the injections have just made you just not hungry at all, and we're taking in, say, 800 calories, just throwing a number out there, but over time, then your body actually resets to that metabolism. And so then as you go to eat over that 800 calories, you can actually see weight gain just because your body has reset that metabolism. And that just unfortunately is not any sustainable way to live off of 800 calories a day for the rest of your life. So that's why we really talk about, like I said, goals, realistic expectations. It is hard whenever people are, have something in mind or a weight loss goal, and then we all get frustrated because, after eating healthy for 2 weeks, I'm like, why am I not skinny?
Right.
But you also want to do it just so that it's a long-term effect.
Yeah, and I think everything with these injections too, or just with a lifestyle change, you have to have some kind of strategy, something that will make sense for you long term.
Yeah.
And if it doesn't make sense, then you adjust. You have those conversations with your patients, and you adjust and you do what makes sense with them, because it's all about what can you stick to long term. Right. So tell us, Shed It is a comprehensive wellness center. Like you can go and you not only get the injections, but you also get the support from your staff members as well. And I'm assuming that that's probably a big reason what it sets you apart from other maybe clinics that pop up that give the semaglutide. So if you want to speak to that a little bit.
It's also the accountability that you have, and also the cheering for you. So when you come every month for your follow-up, you meet with our medical assistant. She does the vital signs and also measures the weight. And if there is a bigger weight loss, let's say 8 pounds, then the medical assistant will point it out and say, oh my gosh, like you did great, you lost 8 pounds, I'm so happy for you. Whereas if you just do it on your own, I mean, you're still happy, but you have nobody cheering you on and motivating you. Also, if there is some issues, some people develop side effects, then they can discuss with Catherine, okay, what is the best strategy now? What can I do to ease in those? Or maybe it was just they didn't drink enough water. It could be plenty of things. And if you don't have a person to reach out to, you may throw in the towel, but it would have been an easy fix.
Right.
And patients can reach us Monday to Friday, 9 to 5. If there's a problem, shoot us a text, give us a call. We're here to help.
Yeah, it's so true. The support really does help make a difference, because you guys are on the journey with your patients.
Yes.
You get to know them, and I'm sure it feels like a family in some ways too.
Yeah, I mean, they come every month. Some people come every week if they don't feel comfortable injecting themselves. So you build those relationships, and you get to know them over the time they see us, and it's exciting. Yeah.
Yes, I love that. Well, if you're just joining us, we are talking with Shed It Weight Loss and Wellness, and we're talking about weight loss injections and getting ready for the summer, especially if you have a summer vacation coming up. And if you have a question for them, you can give us a call at 318-219-4569. And that number is right there on your screen. So you mentioned you have the injections, but you also have a pill if someone maybe doesn't like the injections, but you guys do offer that service to inject it for them, which is really kind, because I don't really like needles either, so I'm sure that's probably a little scary, especially doing it yourself. But tell us about the oral medications and how they differ.
So we offer Qsymia, which is going to be extended release phentermine plus Topamax. So that is going to be a once a day oral medicine. The extended release phentermine is helping with appetite control. The Topamax actually helps with cravings. And so people do benefit from that. That way we don't have to do an injection. There are certain reasons why people can't be on that one. And so again, we have you sit down, talk about medical history, current medications, and then just make sure that it's a fit for you.
Mm-hmm. Okay. And do you ever have patients go from the injections to the oral medications and maybe vice versa?
It's usually the other way around.
Oh, really? And what would be a reason why they would switch?
Just if with the oral medicine, if we feel like they're either not seeing the result they're wanting to, or if they start to feel like they've had some side effects or things like that, then we'll switch. I mean, typically I think the injections are the better option as far as just healthy and just efficiency there. So, but we do have people that do well with the oral. Also, again, really trying to be sure that we're working out, eating good protein, drinking water, things like that. So.
Mm-hmm. Yeah, and these injections, they originally came about for as a treatment for diabetes, right? And so, but now, really anybody could take them as long as, do you have to meet certain criteria to take the injections? There
are certain contraindications on why people couldn't be on them. 2 of those being medullary thyroid cancer and multiple endocrine neoplasia syndrome type 2. But again, we sit down, see, obviously if somebody's BMI is too low and that's not going to be healthy, then we would, not start, things like that. So there's little exclusion criteria, but the 2 main contraindications are those 2 health conditions.
Okay. And yeah, that's something that you screen for at Shut It too. So that's another maybe important thing is that some clinics hopefully are still screening, but for you guys, that is something that you do routinely. So you're not going to give it to somebody that doesn't need to take it and to where it would be, a negative experience.
So unfortunately, we had to turn some patients away.
Okay.
Yes.
Yeah. Right. And so, but you have to do what's best for the patient,
absolutely,
right? So,
absolutely.
Yeah. Okay. And so, talking about the science of the medications, I feel like it's really fascinating for me, I think it's pretty fascinating to talk about the science of it. But tell us about, it works in the GLP-1 and it acts kind of like as a hormone. So tell us how that works.
Yeah. So I tell all my patients, the buzz around these weight loss medicines, the semaglutide, the tirzepatide, people are scared that they're new or that, there's a lot of unknowns, and they are still doing a lot of studies because the weight loss indication is newer. But they've been around for a long time. They were initially used for diabetics. Their class is that GLP-1 because they're working on that GLP receptor on your pancreas, helping your body produce more insulin and better regulate your blood sugar. The weight loss indication or side of it is relatively newer, but they found that it works on that hunger hormone. And so that's kind of what we call that food noise or that cravings, just kind of thinking about food, wanting a sweet treat, things like that. So it helps to just shut that down or at least calm that so that we're just not constantly thinking about food. And then they also, because of how they work by slowing stomach and GI motility, help you just to physically feel fuller sooner and longer. You end up with a little bit of estrogen and progesterone. It's not making hormone, but it's helping balance that out just because of that blood sugar and glucose regulation, So it really does kind of act like a hormone there, like you said. And again, I just try to tell everybody, they're not new medications. The weight loss side of it is newer. So there are obviously still studies to be done that will continue to be done. But the ones that they've done so far, that we've talked about before, but really favorable for other conditions, just inflammatory stuff, cardiovascular stuff. And so anyway, it's just interesting to see kind of how they've progressed and how they'll continue to progress as we study them more.
Yeah, like you mentioned that they've been around for a while, but it's almost like the weight loss was a side effect.
Right, yeah, and truly it was a side effect, and so that's how we have
positive side effect here.
Yeah, for sure. And so now we're able to utilize it to really help with other, I mean, metabolic syndrome, obesity, right? And so, or, you know, the things that come with that. And I know we've talked before that it can help with even decreasing a little bit of inflammation just from weight loss, and the regulation of the blood sugars, which if you have an excess of blood sugar, then that's not a great thing. Diabetes is not really a great thing for your metabolism, for your body. So what other things have you seen in the literature of how these medications are helping patient outcomes, whether that's other diseases?
Yeah, I mean, I think the more recent has been cardiovascular, as far as like lower risk of MI and just plaque, you know, things like that because of inflammation. Also, PCOS is a big subset of, you know, some of our patients, but just kind of in general, PCOS has been this, you know, it's polycystic ovarian syndrome, but just insulin resistant, just women that, you know, try pretty much everything as far as eating well, exercising, and just because of that insulin resistance are just unable to make any headway or progress. They feel terrible all month, they feel inflamed and bloated, don't feel good, and then these have been just such a life changer for those, you know, people like that too. So I think lots of studies to be done on that. I'm interested to see all the cardiovascular stuff. Liver disease, you know, they've shown some improvement there. Some addiction studies have been done, you know, whether it be smoking or alcohol, things like that. So like I said, lots of studies still to be done, but they've really shown improvement in several different areas.
You're right. And the cool thing I think about Shed It is that they come to you because maybe they low self-esteem, low confidence level, and they want to just get back to the being themselves. But they end up having all these other positive things like lower blood pressure and, you know, blood sugar regulation. So tell us about like just some of your patients, some of the wins that you've been able to experience with them.
Well, it's just, I think the majority of the people really come for cosmetic reasons. Ultimately, they want to feel better, they want to look better, but they forget the positive side effect that it's really good for their health too. Like all the patients that lowered their blood pressure so much that they don't need to be on their blood pressure medication anymore, for example, and we have a lot of them, like a lot of them. That includes my mom.
Oh, cool.
I actually brought this medicine last year, like in the summer, from here to Germany and gave it to my mom. And she just started using blood pressure medicine, and then she lost about 13 kilos, which is roughly, probably 25-ish pounds. And she doesn't need her blood pressure medicine anymore, and she is as happy as can be and much more energetic, also sleeps better. So I mean, I'm so happy that I could help my mom, because in Germany it's not that easy to get your hands on this medication at all.
Right, that's so true. And weight loss, I think maybe some people don't realize that even just 5 pounds of weight loss can really even do really good things for your blood pressure too. So, so you know, even if you're not motivated by cosmetic reasons, you can be motivated by, you know, the lab values that you get from your primary care provider as well. Too.
I was just thinking also, jumping in there, people with arthritis, like joints that hurt. You know, we have some people that just lose 20, 30 pounds and joints don't hurt as much, and then they can get up and walking more. We have other people that need to have, you know, knee surgery, hip surgery, and just because of weight, that's a factor, and so they end up coming in to be able to get down to a certain weight to have, you know, said surgery. I've had quite a few that ended up able to postpone the surgery or even not have it, you know, as of now, because of just weight loss. So just feeling better. I think mobility, I have lots of people that come in and their big thing is, you know, I'm about to have a grandbaby and I want to be able to get up and down, and right now I can't. And so, you know, not always cosmetic, but just kind of just feeling better. Like you mentioned, sleeping better. I think people feel, you know, just sleep better, move better, you know, able to exercise more as you just have less of that pressure from just extra weight on you. So
yeah, and I think it's always good to have an extra goal. You know, you have your maybe your weight loss goal, but having a goal like getting down with the
a physical goal, and then also more of like a mental goal and something like that.
Yeah, maybe it feels more motivating because it's like something that will really feel rewarding. I mean, yes, weight loss feels rewarding, but sometimes the number on the scale, it can be a little frustrating sometimes. Even when you do achieve your goal, you know, sometimes it can feel like a difficult goal to achieve. So
I think it's not just the number on the scale. This is where I would like to talk about the Fit 3D body scanner.
Oh, yes.
Because there is a difference between your body composition, if it's muscle or if it's fat. So there is a big difference. And at Shedit, we actually track that. So if we motivate our patients to do more exercise, so they build muscle and eat their protein so they can really build muscle, they should lose the fat and build muscle. So maybe they do not lose as much weight, but you can still see that they shrink because they're just more compact because they have more muscle instead of fat.
Right.
And I think this is one of the best tools that we offer at Shedit is the Fit 3D body scanner.
Yeah, so the Fit 3D body scanner is something that you can, anybody
can do it.
Patient,
yeah. You don't
right?
have to be a Shedit patient. I think it's also interesting for people that just work out and see what their body composition actually is. And if all the work that they're doing in the gym is actually working for them, maybe they do not have enough protein intake, although they work out every day or every other day. And I think it's just interesting to see what your body looks like.
Yeah, and it's kind of like the in-body scanner, but it's probably a little bit more accurate, and it's uses maybe AI technology to come up with that, or how does that work?
I'm not sure if it uses AI.
Okay.
It's like you stand on a turntable, you press the two buttons, it spins you around, and there's 3 cameras, one like up, one in the center, one down, and it takes like 3,000 pictures a second of you, and it creates an avatar, and you can really see everything, every tiny little fold. Like, it's not pretty sometimes, but I mean, it's the reality. And if you are a weight loss patient, you can really see the shrinkage over the months. And I think this is really motivating.
Yeah, for sure. And it's like a good thing to look back on, because I think sometimes we forget, especially when we see ourselves every single day, we forget how our body will change.
Yeah.
It's kind of like that saying, it takes 6 weeks for you to see a change, 8 weeks for your family, and 12 weeks for the world, or something
else.
like
Yeah,
that. That
something
quote
like that.
that's floating around on Pinterest or something, you know. But it helps to see that change too. Like you said, it motivates them.
Yeah.
So, so that's just another way that you're able to support your patients.
Exactly. And the keeping the muscle mass is so important, especially later on about sustainability. When you get off the medication, you want to make sure that your metabolism is still going strong. And if you have the calorie deficit that Catherine was talking about and lose your muscle mass, it's basically impossible to not gain weight back. And we want to make sure that this does not happen.
Yeah, for sure. And so muscle is really important. And so you guys, how important is exercise, and how important how do you encourage your patients to exercise?
Exercise is also really important. You know, cardiovascular or just any sort of cardio, walking, light jogging, things like that is good for your heart health. But strength training is so important to build that muscle. And that's, you know, muscle is where your metabolism lives.
Go ahead.
Anything you do at rest, the more muscle you have on you, the more you're going to burn, the higher or more you can eat technically, because your body's burning more. Obviously, we have some people that if that's a limitation from their doctor, or if they're not able to exercise, we talk about starting slow, even if it's short walks, things like that. But really, you know, the exercise is an important part of it. And so we do really try to talk about that, you know, not stretching physical limitations, but, you know, I tell anybody anything you can do to put on any kind of, if it's a couple little dumbbells at home, things like that, just anything you can do to build muscle is going to be just good for you overall. For
sure. Yes. Well, we have our first caller. Tom, thanks for joining us. And what's your question?
Yes, I would like to know, or if you would speak to or address, there seems to be coming out, and you really have to look for it, as almost there's a cover-up of it, of the side effects from that injection medicine. I mean, I know it's new, so there's probably a lot not known yet, but there are just many of them. If you research it, it's hard to find it, but if you could speak to the side effects, I would appreciate it.
Sure.
So side effects are all pretty much going to be GI related, because it can slow that, they call it stomach and GI motility. Side effects, and anytime someone comes and sits down with us, we talk about side effects, but things like nausea, vomiting, you know, the medical term for that is more like gastroparesis, just meaning that your stomach has gotten so slowed that things actually don't move through like they need to. People can have abdominal pain. There's risk of pancreatitis if we're not drinking water, doing things like we need to be doing. So basically anything in that GI system is going to be your major side effects. And again, if anybody, sits down and starts medication at Shed It, we do sit down and talk about all those side effects and things just to be transparent and so that you go home and do well, without being surprised by side effects and things like that.
Right. And maybe changing your diet a little bit will help, because some people maybe they ate 3 large meals a day and now they have to do smaller meals because of that slowing of the metabolism.
Fried fatty foods can aggravate digestion, and so we talk about that. So I would say that GI side effects, big ones being things like the gastroparesis, pancreatitis, things like that, are all side effects that can happen. And certainly on any commercial you'll hear or any research, there's going to be side effects out there. So
okay, yes. And one thing that you do to address that is, obviously you talk to the patients, but if it's pretty severe, what then happens? Do you switch them to like a different type of, like semaglutide to tirzepatide, or the oral? Like, has that helped your patients before?
Yeah, and I've had a few that have had, we have them obviously hold it at first, be sure we're drinking water, really monitor that, have them come in, really follow up on that, and sometimes we'll switch. Sometimes it's a dose issue, just too much of a dose. Sometimes I've not had a lot of severe by any means, but just people that really weren't doing right at home and abusing it, and just really trying to clarify that. Since I've been doing it, I've had one that I've had to just have him stop it completely, and that was, doing everything right at home and just was having gastroparesis, just to the point, we talked 4 times a week, just kind of following up once I knew that something was wrong, and it was just, we're not going to tolerate this medicine, so. Yeah,
definitely. It goes back to being an individualized approach, and something that you talk about with your patients. And you check in frequently to make sure you're checking for things like that, right? And so it's not like, here's to the medication and we never want to hear from you again, right? You definitely want to make sure that they are not feeling really bad while they're on it, so and achieving their goals.
Yeah.
And there are some people, it affects people so differently, because there are some people that may not have any side effects at all. But then I've also heard that there's some people that maybe they respond really well and they are super losers, like they lose a lot of weight.
Yep.
And there's some people that don't respond at all.
We have some of those. I actually think I brought pictures today. I'm not sure if we can take a look at those. As a woman, sometimes I feel like men lose the weight much faster than we do. It's not fair, but it's just the reality. I think that's what we've seen. We have a couple of male patients that lost the weight like this. No side effects, still doing great. And there is a couple of patients that did extraordinarily well.
Okay, right. And it's like you're so happy for them, but then it's probably frustrating knowing that it just impacts people differently. Yeah. And you really, it's like you're setting the expectations up in that first meeting, saying, this is things that can happen, like the side effects. Right. And then these, kind of disclaimer of results may vary, unfortunately. But, I guess if anything else, do you feel like it also affects the way that the appetite is as well? Like some people, it doesn't affect their appetite, and sometimes it does.
So we start everybody out on the lowest dose, which is just safe and pretty common practice. And I have some people that say, it didn't seem to affect much, and I have some people say that they just, just didn't think about food again. And I think people have different levels of that, just food noise, or kind of thinking about food too, because I have people that say, they're not even necessarily hungry all the time, but they're always thinking about food, which is what drives them to eat. So I do think that has something to do with who does, more affected or not affected, is just people that are constantly thinking about that food, because the GLP medication does help to shut that off too. So I'd be interested I don't know if they have any way to study or track that, but just if they could, to see if that has any difference in people's responsiveness to the medicine.
And how it's so tied to like that emotional side of food too. So, okay, well, we have about a minute left. So tell us, if someone is sitting at home and they're interested in starting working with you guys, where can they find you?
So if you want to find some more information, you can look us up online at shedit.com. You can also give us a call, and our wonderful receptionist Kelsey will take care of you. The number is 318-746-3880. You can follow us on Facebook and Instagram, and lately now TikTok as well. So you can
Awesome.
see what fun reels we do all the time, or TikToks. Yeah. If you have any questions, just give us a call at 318-746-3880, or email us at info@shedit.com, and we can answer your questions or set you up an appointment.
Right, and Shed It on Shed Road in Bossier
Shed It on
City.
Shed Road. Yes,
All
ma'am.
right. Well, thanks, ladies, for joining us. This will be on our website at ktbs.com/podcast.